India accounts for a quarter of all global tuberculosis cases. This infectious disease is one of the top 10 causes of death in the country. Unfortunately, an estimated 800,000 cases were missed being diagnosed in 2021 and reported to the National TB Elimination Program. What's more worrying is that one untreated TB patient can further infect 15 individuals. The tools currently used for the detection of TB are expensive, require special skills, and have a complex lab setup. Hence, the need of the hour is a rapid, non-invasive, easy-to-use, point-of-care tool for the screening of TB. Coughing is one of the most predominant symptoms in cases of pulmonary TB. Studies suggest that artificial intelligence-based solutions can help in the rapid screening of TB patients. Cough sound data may lead to an early diagnosis of the disease and can be used as the foundation for an AI-powered solution to screen TB patients. Towards this purpose, the USAID-supported Trace TB project in collaboration with NTEP and WHO collected these cough and voice sounds from more than 38,000 individuals across 748 districts. The data was further validated to establish the TB and non-TB cases and later used to train the AI/ML model. The AI model is being trained on cough and voice sound data collected from TB and non-TB cases across the country. The audio inputs are converted into spectrograms and are fed into a neural network that predicts TB-positive patients. The initial results are very promising, and with further data inputs, the results are expected to be further improved.
Wadhwani AI is in the process of developing a solution in order to detect tuberculosis using cough sounds. The CTD has been extremely cooperative and helpful and has driven the initiative of collecting over 30,000 points of data across India. Over the next 8 to 10 months, we expect to get significant amount of data which will allow the solution to become very robust, starting with controlled settings onto semi-controlled settings and onward to the entire population of India. We believe that this initiative is going to be a significant part of the TB elimination program and ensure that active case finding can be significantly improved using this solution.
Artificial intelligence and machine learning have begun to transform healthcare and infectious disease control. Their application to India, a global leader in innovative solutions, seems boundless. USAID is working to accelerate game-changing AI solutions in TB care to innovate better solutions for decision-making at a local and policy level. We are proud to partner with the Government of India in developing creative and impactful solutions to pressing challenges, including a cough sound-based AI solution for the screening and triaging of TB cases.
The aim is to develop an AI-powered cough voice-based screening tool for an early detection of tuberculosis. This AI-powered solution will enable and support case finding, putting more patients on treatment to contribute to the goal of ending TB by 2025.